Konsulta program, which provides primary health care services for its members. Anakalusugan Partylist Representative Ray Reyes points out there are not enough Konsulta program providers in the country. For more on this and other concerns in the health sector, we are now joined by Congressman Reyes. Good morning, sir. Thanks for joining us.
Hi, good morning, Kat, and thanks for having me.
Okay, so as of March 31, you say that there is about 1,931 of the required 5,000 accredited Konsulta providers. That's a little over just a third of the required number of accredited providers enrolled in the program. What went wrong there, sir?
One of the things that we have to understand is the basis of the Konsulta package. This one is supposed to be part of the response to the universal health care, where we are intending to provide preventive medical healthcare services to every Filipino so that we may have a baseline on their current medical condition. And what is coming out here is there's not enough facilities in most of the far-flung areas, as well as there's not enough doctors that are to be accredited. We could point this out to there's a lack of interest already in these areas. Also, there is a delay in the accreditation, as there were some confusions with regards to the accreditation criteria. And this was something that we clarified with some of the regional officers of Philhealth about a few days ago. And I think that once this has been clarified, we do expect a better uptick on the accreditation and therefore consequentially the registration.
That seeming lack of interest, how do you actually address that? How do you further incentivize these healthcare providers, these medical practitioners to take part in this government's program?
The thing that we've gathered and we intend to verify is it's really more of a reputation of Philhealth with the relationship on these providers, because I think we've seen over the past few years that there is always a problem with Philhealth when it comes to either its corruption reports or sometimes even its delay in the payments. And that's why you've encountered over the past few years where some even wish to already remove themselves from the Philhealth system because of this. So we do enjoin Philhealth that they address these concerns of these accredited providers, that they could be paid on time, that there is no corruption involved with regards to accreditation, even in the reimbursement, and on the disallowances of some of these reimbursements.
Okay, sir, how much was allocated for this project under the 2023 budget, or is the entire funding coming from the income of the Philhealth?
Yes, it is supposed to be coming from the fund of Philhealth, which is another thing that I actually wish to address, because during the budget hearing over the previous years is even the most basic of questions to ask, what is the fund health of Philhealth? Which I think is the right of every member to know, is something that they were not able to address. And so coming into this new budget season, we intend to address this again so that we could actually find out the fund health of Philhealth.
Doesn't that actually raise a red flag? Philhealth not being able to directly answer questions with regard to the longevity of its fund for its members?
Well, Kat, that already came from you. And yes, that is actually our sentiments. And I believe that this kind of sentiment should be addressed, and that our fellow Philhealth members should be informed that the most basic of questions with regards to the actual fund and the life of Philhealth needs to be answered.
This problem with regard to Philhealth, concerns over corruption allegations, the delay in the payment of hospitals, of claimants, it didn't happen overnight. It actually stemmed for several decades already. How can you actually address this in the lower chamber?
For us, we've always been asking that we also join the oversight committee on this. The Anakalusugan Partylist, has been its advocacy over the past years, even before we became a representative in Congress, that there should be transparency and there should be a quick response with regards to the questions of the people. So expect us that this is something that we will address also in the coming weeks.
Aside from addressing the reputation problem of Philhealth, do you think adding more incentives for medical professionals would actually entice them to take part in this program?
That's a great question. And like in our healthcare system, it's just not just a linear solution. Yes, we have to look at it from other dimensions where even our doctors, our nurses, our medical practitioners are not properly compensated as compared to the world standards. And that's why we'd also want to push for this so that we don't have a lack of medical practitioners who just choose to go to greener pastures and be properly compensated. Now, this one is not just for Philhealth. This is already more system-wide, where their salaries, their compensation structures are aligned to something that is world standard.
And what possible incentives, additional incentives, apart from those that are already existing, are we looking at with regard to medical practitioners and facilities who may want to join the Konsulta program?
It's the case rate. I think that needs to be verified. This is something that we have to verify over the next few days. But something as simple as having a more responsive reimbursement mechanism for whatever expenses that they have incurred in providing these services. Sometimes it's actually more than enough. I believe that we're trying to verify reports that sometimes it takes more than 90 days for some of these medical facilities who are accredited by Philhealth to be reimbursed for the expenses. And when you look at it from cash flow basis, it's a bit too late. It takes too long, and bills have to be paid. So we'd want that if something more responsive, maybe if they could reduce it to around 45 days, this is something more manageable already, and this should be able to incentivize some of our medical facilities to join this Konsulta program.
And honestly speaking, Congressman, do you think that that kind of incentive would actually outweigh their concerns with regard to the Philhealth's management of its funds?
I believe so, because what is coming out is even just the most basic responsive government is all that some of these medical facilities are asking. And everything else could still be negotiated. I guess you could say that. It's something that can take a back burner, but just the responsiveness on the reimbursements could really help a lot. Also, great support from policies, also from the Department of Health, would really be of great help.
Okay, shifting from the supply side to the demand side, would you have data on which regions are in most need of these accredited Konsulta providers?
There's no specific data on the region, but one thing that we could address is that highly urbanized cities, those urban areas, are sufficient, but it is in these far-flung areas, whatever region that it is in, needs to have adequate facilities. This could either be private facilities or government facilities, and this is where I'd like to take a segue with regards to the funding of the Department of Health. Some of the things that we've discussed with the Department of Health was that sometimes when they present their budget, because I understand that there are so many other aspects in running a government, but sometimes their budgets could be cut by as much as 45%. And I think after the pandemic, I think it's about time that we prioritize this along with other basic services, because we do not want to be caught unguarded again, like how it was in the pandemic, where we do not have even adequate facilities or hospital beds or even rooms. So it's all a matter of planning the actual capacity to prepare for the next pandemic.
Okay, and speaking of the COVID-19 pandemic, since you mentioned it already, is the Philippines actually ready to join other countries in lifting the emergency health status and protocols for this disease?
The basis for that was because of our ICU and other hospital utilization rates. And since we have somewhat an acceptable rate of vaccination, we could see the ICU beds and other hospital beds utilization due to COVID already decreasing. This was the basis of the crisis before. It wasn't necessarily the number of cases, because if there are cases, but these are mostly manageable at home, then it wouldn't burden or it wouldn't collapse our healthcare system. So at the current rate that we are in, I think we are quite ready. But again, I enjoin the DOH to say that let us still be prepared. We are looking at a virus that is rapidly evolving. We cannot already count how many evolutions or variations of the virus have already come out. So that's the best way to prepare for the next pandemic, is that we have to make sure that we have the adequate capacity.
As you mentioned, hospital occupancy rate in the country is no longer at a critical level. But then again, the DOH says that it logged nearly 10,000 new cases of COVID-19 in the first week of May alone, adding that the daily average of fresh cases has spiked by 112%. Would you still support the Philippines' move to actually join other countries in lifting the emergency status of the COVID-19 pandemic? Or should we rethink this given the spike in cases?
So, Kat, if we may look at the spike in cases, but let us also look at the hospital utilization rates and also the nature of those who are hospitalized. Now, we're trying to verify reports that some of these that are hospitalized are actually already the unvaccinated portion of the population. But those who are vaccinated have been able to manage these cases even using home remedies. So I do state that, sure, maybe for now we are quite ready, but let us be cautious, because if we do not have the sufficient hospital capacity, and now we are already experiencing that the virus is evolving, and remember that the vaccines that we developed was something rapidly developed just because of the COVID response. Some of these do not have long-term immunization capabilities, and that's the reason why you could see us vaccinating quite often. So we do need to stack up on these new bivalent vaccines that are more stable. They could have a longer shelf life. They have a longer immunization efficacy.
Okay, jumping off on that point, you mentioned bivalent vaccines, the country's need for it. But then again, when we lift the emergency health status of the pandemic here in the country, another concern of the DOH is that it will no longer be allowed to procure certain health products under emergency procurement laws. Would you consider lifting the emergency health status in the COVID-19 pandemic, even if the government still needs to procure more bivalent vaccines? Can the government already procure this under the regular procurement laws?
That's a good question. And yes, we cannot do that with current laws on emergency purposes. However, I think we have shown that if there is a need already, and we could incorporate this as part of our exit strategy for COVID, is that we allow emergency purchases through executive orders for this. But again, a very careful and delicate line that we have to take, because we have to determine really when do we consider it an emergency. But for us, given the current hospitalization rates or ICU utilization rates, we are in a manageable position to not call it a crisis right now.
All right. And to end this interview, Congressman, how soon do you think can the Philippines lift all restrictions with regard to the COVID-19 pandemic?
To us, Kat, our opinion is the vaccines work. And if you think about it, that's the reason why we were able to at least have a certain semblance of normalcy in the way we do things as compared to 2020 and 2021. And this was where we enjoin everybody to try to get their vaccines if they have not completed their series already. The vaccines really work. So I do enjoin the DOH to keep on pushing the information campaign and to inform the public that the vaccines work. This one actually prevents them from having any material losses in their lives. So I think this is part of the best exit strategy.
And we will have to leave it at that. Thank you so much for joining us this morning, Congressman Ray Reyes. He is the Vice Chairperson of the House Committee on Health. Good day, sir.
Thank you very much.